Nursing care of patients with gas exchange disorders. Cystic fibrosis is an inherited disease that causes the body to produce mucus that's extremely sticky. The mucus in people with CF is thicker than normal because CF affects cells in the epithelium, which is the layer of cells that lines the passages in the body's organs. In a person who does not have CF, the epithelial cells produce a thin, watery mucus that acts like a lubricant and helps protect the body's tissues. In a person with CS, however, the thicker mucus doesn't move as easily. This thick, sticky mucus causes passages in many of the body's organs and infection sets in. The two organs that are most affected are the lungs and pancreas, where the thick mucus causes breathing and digestive problems. The thicker mucus has trouble moving out of the lungs, so bacteria can remain and cause infections. The thick mucus can also be found in the pancreas, an organ that produces proteins called enzymes that flow into the pancreas to support the body's digestion process. Because the mucus can block the path between the pancreas and the intestines, people with CF have trouble digesting food and getting the vitamins and nutrients they need from it. CF can also affect the liver, the sweat glands, and the reproductive organs. When the protein is defective, as in cystic fibrosis, the salt balance in the body is disturbed. Because there is too little salt and water on the outside of the cells, the thin layer of mucus that helps keep the lungs free of germs becomes very thick and difficult to move. And because it's so hard to cough out, this mucus clogs the airways and leads to infections that damage lungs. The most characteristic symptom of CF is the excessive production of thick, sticky mucus on the airways. In CF, the cells lining the airways do not transport salt and water normally, so mucus and other airway secretions may be depleted of water, which become abnormally thick. There are also chemical changes in the mucus proteins. The mucus becomes so thick that it clogs the airway and provides an environment in which bacteria thrive. In response, white blood cells are recruited into the lungs to fight the infection. These white blood cells die and release their genetic material, sticky DNA, into the mucus. This DNA aggravates the already excessive stickiness of the mucus, setting up a cycle of further airway obstruction, inflammation, and infection. To dislodge the mucus, CF patients cough frequently and require time-consuming daily chest and back clapping and body positioning to drain lung secretions. Atelectasis. This is a collapsed part or all of the lung. Atelectasis is caused by a blockage of the air passages, the bronchus or bronchioles, or by pressure on the outside of the lung. In acute atelectasis, in which there is a sudden obstruction of the bronchus, there may be dyspnea and cyanosis, elevation of temperature, a drop in blood pressure, or shock. In the chronic form, the patient may experience no symptoms other than gradually developing dyspnea and weakness. X-ray examination may be a shadow in the area of collapse. If the entire lobe is collapsed, the X-ray will show the trachea, heart, and mediastinum deviated toward the collapsed area with the diaphragm elevated on that side. Bronchoscopy may be included in diagnostic procedures to rule out an obstructed neoplasm or a foreign body if the cause is unknown. Other characteristics include diminished breath sounds, fever, and increasing dyspnea. Acute atelectasis is treated by removing the cause whenever possible. To accomplish this, coughing, suctioning, and bronchoscopy may be done. In atelectasis due to airway obstruction with secretions, chest physiotherapy is often useful. Chronic atelectasis usually requires surgical removal of the affected segment or lobe of the lung. Antibiotics are given to combat the infection that almost always accompanies secondary atelectasis. Bronchiectasis is a condition in which damage to the airways causes them to widen and become flabby and scarred. Bronchiectasis usually is the result of an infection or other condition that injures the walls of the airways or prevents the airways from clearing mucus. In bronchiectasis, the airways slowly lose their ability to clear out mucus. When mucus can't be cleared up, it builds up and creates an environment in which bacteria can grow. This leads to repeated serious lung infections. Each infection causes more damage to the airways. Over time, the airways lose their ability to move air in and out, and this will prevent enough oxygen from reaching the vital organs. Bronchiectasis can lead to serious health problems such as respiratory failure, atelectasis, and heart failure.